Hi everyone, good afternoon. Welcome again to another episode of Doctors Code on Columbia Asian page. Today we have a very special guest with us. She is an experienced pharmacist, and why she's here is because the topic is about getting the most out of your medication. We all have at one time or other taken medication, but perhaps there are some things that we are not doing right. So to explain about the do's and don'ts of how to get the best out of your medication, we have with us Ms. Kaveeta Pergas from Columbia Hospital, Seremban. Hi, Ms. Kaveeta, how are you?
Okay, I'm good. Hi, everyone. Thank you for the introduction, Sakina. Hey, Facebookers, so glad you guys took out your time to join in this live session. So are you all ready to discover how you can get the most out of your medication?
Okay. Yes, definitely. On behalf of Facebookers, I'm answering on their behalf. Okay, perhaps you can just start off with the first question. I understand that there is a checklist for every pharmacist. What do you call it? Prescriptions. Before they give medications, there's actually a checklist so that you need to make sure certain things are looked into before you give them medication. What are the things that are on this checklist?
Okay, let's just move on to the next slide, please. Okay, so before... Yeah. Oh, okay, got it. Okay.
Yeah, I remember because I used to watch it when I was little. I remember there's a song.
Yeah. Okay.
A little bit of sugar makes the medicine go down.
Right. So let's just briefly go back in time. Depending on which you come from, this Disney character may seem familiar from your childhood. So Miss Poppins, the kind of magical governess every kid wish they had. I mean, come on, it's not every day that you come across a nanny who has this flying umbrella and lets you do cool stuff down the stairs banisters. So anyway, Miss Poppins may have actually been a blessing in disguise for most parents when it came to get their kids to take their medicines. Okay, thanks to her famous spoonful of sugar and the medicine goes down song. Okay, obviously Miss Poppins is not encouraging you to actually have a spoonful of sugar together with your medicine, because if that had been the case, then almost 99% of the human population would be infected with diabetes by now.
Okay. Yes, that's true.
The whole idea of this was how to make taking medicine seem rather fun than more of a hassle, whereby the line spoonful of sugar psychologically provides the extra sweetness needed to transform an unpleasant task, which is taking medication, to something that is a bit more simple, like a piece of cake. So I myself remember being placed on the kitchen counter and my mom would be singing lines from this song, and before the medicine would be going down my throat in the most delightful way. So yeah, but I'm not certain if it works with kids nowadays. So anyway, to your question, about our checklist. Yeah, that's
about the checklist.
Okay, so let's get started with the very basics of medication administration. Some of you may be familiar with the 5 rights of medication administration by now. Thanks to the Ministry of Health, they are doing this Know Your Medicines Kenali Ubat Anda campaign. And this campaign was introduced to raise awareness to consumers on quality use of medicine in ensuring wise, safe, and effective use of medicines by the consumers. Okay, so what are the 5 R's of medication administration? So we'll start with the first R, which is supposed to be administered to the right patient. Okay, the second R would be with the right drug. And the third R is according to the right dose. Fourth would be the right route. And finally, at the right time. Okay, so yeah, let's just move on to the next one. Okay, how would you know that it is the right patient? Okay, I know hospital visits can be a pain for most patients. Even myself as a healthcare provider, I dread hospital visits. I mean, patients come early in the morning, get themselves registered, run necessary tests, see their doctors, and they're completely exhausted and hungry by the time they get to the pharmacy, and all they want to do is collect their medications and go home. Okay, but have you ever taken a few minutes of your time to check through your prescription, If you do, that's great, good for you. If you don't, please do, because it's from your prescription you're able to identify if the first R is actually right, if the prescription is actually meant for you. Are you the right patient? Okay. And okay, since we're talking about prescriptions, let me just share with you how this piece of paper often comes to the pharmacy looking all washed up, as though it's gone through the washing machine a couple of times, folded as if it's a piece of origami paper. It's a wonder it's still alive when it reaches the pharmacy. So anyway, your prescription is just as important as all your other documents, such as your IC, your passport, your birth cert, your marriage cert. I think some of you won't even let one crease get onto your marriage cert. Some of you even laminate your marriage cert. Okay, but I'm not asking you to laminate your prescription, okay? But maybe just treat it with a little more TLC, because it's, after all, it's what's in the prescription that's keeping your health in shape. Okay. Yeah. All right, coming back to the prescription, okay? So your prescription slip should have your full name as per your on it. Okay. Yeah, together with your IC number and your registration number. Okay. Go along, I will be sharing with you some what I call as hashtag Kisah Benar episodes, okay, which I have throughout my practice. That sounds interesting. Yeah. So, okay, this is not to make fun or critique anyone, but it's just please guidance, room for improvement. Huh? Okay, so examples, you mean? Yeah, let's start off with the first Kisah Benar that I've encountered. Okay, so patient comes to the pharmacy counter and identifies himself as Andy. He says, "Oh, hi, I'm Andy, and I don't have a prescription or any medication for Andy, but I do have a prescription for Muni Andy." So,
I see.
Yeah, yeah, my name is Muni Andy, but I'm so used to being called Andy, so you can call me Andy. Okay, face palm, right? Anyway, upon collection of your medicine, you're advised to identify yourself clearly by providing your full name. Okay, please, no nicknames. Yes, no nicknames, no, my Instagram name, my number manja, all these things. Okay, so because there might be a possibility that your nickname is actually someone's real name, so we wouldn't want to mix up all this, you wouldn't want to go home with someone else's medication and, it's really trouble. So also it'll be good if you could provide your birth date and the last 4 digits of your IC number as additional confirmation that you are the right person. Okay, so I understand that most patients have already lost their patience by the time they reach pharmacy, tired, hungry, and, parking timer is almost up, they want to extend the time. So here's another Kisah Benar episode whereby as soon as the patient's numbers are called, immediately all of them transform into Usain Bolts and rush to the counter, collect the medications, and this line is very familiar where they say, "I'm a regular, I know how to take these medications," and leave the counter. So all this is done under 10 seconds, okay? So yeah, when you receive your medication, before you leave the counter, it's very important for you to check every medication should be labeled with only your name, okay? If you notice that your prescription or medication label does not have your name on it and is addressed to someone else, please immediately alert the staff on duty and make sure the necessary correction is done, even though it may be a drug that you are regularly taking. So yeah, get somebody to look into it. So how would you know that you're actually taking the right drug, which is the second most important R? Okay. Always go back to your, hang on, it's still the prescription one, yeah, okay. Always refer back to your prescription, so the medication given to you should be the same as prescribed by your doctor in the prescription. Okay, see how the prescription is? Yeah, maybe you should consider getting it laminated. Okay, I'm just kidding. So first, get to know the medication you're taking and what it's typically indicated for. Okay, you can start getting the name right. Okay, I know this is a challenge for patients as well, seeing that certain medications are just impossible to pronounce. And to be honest, even I myself have difficulty with the pronunciation of certain drugs. So it's okay. Patients have even asked me like, where do these names come from? how is it that drug companies are able to come up with such tongue-twisting names?
Yeah.
So another case of burnout episode is where I've had patients coming in saying, oh, I'm here for the eye drop that sounds like AC Milan footballer's name. And I'm like, okay, AC Milan. Okay, you mean Zlatan? Yeah. Patient goes like, yeah, Zlatan Ibrahimovic. So yes, we do. It's an eye drop called Zlatan. Yeah. So patients actually associate drug names with what's happening right now, current happenings. And there's another one. Can I have the Barracuda drug? It's actually Barracuda, but they associate the Barracuda fish to the name of the drug, Barracuda.
Yeah.
Anyway, then there's the whole confusion of drugs which go by the generic name or the brand name. This is a typical scene in most pharmacies whereby you probably have a patient who comes in and says, oh, hi, I'm here for Piriton, but this says chlorpheniramine. Then we explain that it's the same thing, and patients would probably ask us, how is it the same thing? So chlorpheniramine is the generic name and Piriton is the brand name.
Okay.
So patients would ask us, like, how is it that drugs are so privileged to have two names and we humans only go by one name? I certainly can't answer for the human part, but I can.
Those are the brand names. So the generic name is actually just one.
Yeah, so the brand name of medication is the name given by the company that makes the drug, and is usually easy to say for sales and marketing purpose. Okay.
Right.
The name, on the other hand, is the name of the active ingredient or chemical name of. So anyways, brand name or generic name, if the indication does not match your diagnosis, please don't be afraid to question the order. Okay, we'd be more than happy to double confirm the prescriber rather than taking home the wrong drug, okay? Or taking home the right drug, but not knowing what it's for. Okay, so then the next R would be the right dose. So only dosage prescribed in your prescription and medication label or as instructed by your healthcare provider. Okay, it's very important as this dose has been determined based on factors such as your age, your body weight, your results, kidney, liver function, medical history, allergies. Yeah, so it's basically the So for some So for some medication, the dosage must be determined by trial and error. For example, insulin, which is used by most diabetic patients. Insulin dose will probably be based on your daily blood sugar levels. And another example would be warfarin. It's an anticoagulant tablet whereby the dose will be based on the INR levels. So in this kind of cases, close monitoring and frequent follow-up with doctors is very important, because you have to keep, changing your dose accordingly. So then, there are drugs which go by the same name, but available in different strengths. Yeah, so I know what you must be thinking, you just got the name pronunciation right, and now I'm telling you there's like a whole family of them, okay? So why are there drugs with multiple strengths, okay? Multiple strengths of medications actually provide doctors the flexibility they need to meet different patients. So the strength of a medicine is actually the amount of active ingredient contained in the drug. And strengths are usually quantified as milligrams, micrograms, or grams. Yeah. Okay.
Kaveeta, can I ask you something? You were mentioning just now about generic names and brand names. So let's say paracetamol, which is very generic lah. Okay, and then you have paracetamol brand A, perhaps something that you get from government hospital, and then you go to a pharmacy, to a pharmacy, and you get paracetamol brand B. So between the two, would it be exactly the same, just different packaging, different names? But would they do exactly the same thing, and the content, would it be identical?
Okay. Okay, if it's paracetamol, then yes, both should be on
the same. Paracetamol is paracetamol.
But the strength has to be the same. So because paracetamol nowadays comes in different scents, you have the 500 mg, you have the 650. So if it's, etc., the same, it's fine. It's just that it's been manufactured by a different company. So yeah.
Okay, so that's all the difference there is. Is that the case with medicine as well?
Sorry?
Is that the case with other medication as well? If it's not paracetamol, because we're talking about psychotropic drugs, and then there's lamotrigine, but there's Lamictal, and then I think there's another brand name, I can't remember. But do those drugs, if they go by the generic name, would they do the same thing, or there's a different?
Yeah. Okay, I get your question. Yes, basically it's meant to do the same thing, and it has to go by the same strength.
Okay.
Yeah.
Okay. All right. Well, let's just move on. I'm just curious because I think that's also something that is on a lot of people's mind, because they do have medication, but the regular medication, some months they will get brand A, and then another month they will get brand B, and then they get all confused. It's supposed to be
that normally happens when there's like a stock issue.
It's not the same, yeah.
Buyers are not
take this last
stock. Yeah.
Okay, well, it's okay. Just to clarify, so it is supposed to be the same thing, lah.
Yeah, definitely.
All right.
Okay. So
yes, we're looking at the sticker right now. Perhaps it's time for us to move on to the next slide.
Please do.
Okay. Okay, this is about dose measurements. Patients make sure that they get the right dosage when they take the medication.
Yeah. So sometimes if you're lucky, your dose can be straightforward. So, just swallow a whole tablet. Sometimes you may be required to take half of a tablet or even quarter of a tablet instead of taking the whole tablet. So pill is also a common strategy among patients looking to save money, amid the rising cost of drugs. So how would we manage this? Okay, this is another Kesa Benar episode here where I have the top 5 answers from my patients, how they would split their pills. So the knife, of course, is the most popular choice, followed by the others. So some tell me that they split their medicines with scissors. There's a blade. Some crush them with a hammer, and some even just bite it lah. Okay, so all this is completely wrong. Let's move on to the next slide. Okay, have you ever heard of a tablet cutter? Okay, I'll just basically go through why you should use a tablet cutter instead of the previous slide.
So you can actually get this at the pharmacy.
Yeah. So firstly, the benefits of using a tablet cutter would be your medication won't taste or smell like onions, garlic, meat, or anything that's been cut with a kitchen knife. Okay. All right. Secondly, they're designed to make dividing medications easy as possible, providing you with the accurate dose. Okay. Then they're also small in size and convenient to carry around while traveling. So, imagine if you're traveling and you're carrying a knife with you to split your pills, you probably have a lot to do if you were caught by the police, you'll be sitting in a lockup and waiting to be transferred to hospital bahagia lah. Okay. So then finally, it's safe. Using a tablet cutter is much safer than using a knife and
and it's so easier. It's quicker. Yeah,
that's right. Yes, So therefore, if you don't have one of these, I would suggest you head down to your nearest pharmacy and actually invest in one. Right. But however, please do not go on a splitting spree without receiving approval from your pharmacist or your physician. I'll tell you why in the next slide.
Oh, there you go.
Okay. So, all right. Not every type of tablets should be cut. Kind of like just how the iPhone has evolved. There are so many versions. Same goes to the simple tablet. So now we have the slow release, modified release, extended release, film-coated, enteric-coated, chewable, effervescent, sublingual, and layer tablets. Okay, so certain drugs can actually be split without reducing drug efficacy or causing side effects. But then there are certain medications such as delayed or extended release tablets or pills with protective coating for the stomach. which should not be. So
All right.
then drugs with a hard coating or any sort of capsule which should also be swallowed as a whole to avoid crumbling, leaking, and cracking into pieces. Right. Then there's another type of medication whereby certain prescription medications deteriorate when they are exposed to air and heat and moisture. So it's best to actually split this only one at a time to ensure the potency and dosage sizes are consistent.
That means you don't just make things easier for you by just slicing everything at one go and then keeping them in a medication in a pill container.
Yeah, certain tablets is fine, but always go through the storage conditions first, because the ones sensitive to air and moisture, those should not be split in at once. You just do it on the day at the time that you're actually taking the medicine. Yeah.
Okay.
All right, so let's move on to the next slide.
Sorry, Kaveeta, can I just ask something about the previous slide? How would a patient know about the type of medication? Because we know now that these are the types of tablets that should not be cut, but to a patient, how would they know this unless they ask?
Yeah, so basically, normally when we are dispensing the drug to the patient, we will have all this information. We'll provide the patient with this information. The patient actually refer back to us, can ask us or physician about the drugs. Yeah.
So this is why it's really important to talk
yes
with the pharmacist rather than just grab and go. There's a lot of things taken into account.
Yes.
Okay. Another thing about tablets that could be cut, because I know some of the pills, they actually come with a line in the middle, and when you press it and it breaks in two, and it looks just about right. It looks about 50-50.
Yeah. So some pills they come with a spot line. So yes, that's like a guide for you how the medication, where exactly you should
break also.
Yes.
Okay, all right, maybe let's take a look at the next slide. Measuring spoon. Okay.
So when it comes to oral liquids, the oral liquids usually come with a dose delivery device, such as spoons, syringes, and medication cups. So let's start off with measuring spoons. So back then, household spoons used to serve the purpose of measuring oral liquids, whereby they use a simple conversion of 1 teaspoon equals to 5 ml, 2 teaspoons would be 10 mils, and 1 tablespoon would be equivalent to 15 mils.
Okay.
However, household spoons are now no longer recommended to be used as a delivery of medication, as sizes may not really be accurate, So if you do want to use a measuring spoon, please make sure it's one of the calibrated ones. Yeah, so it should actually state if it's 5 mils, which side of the spoon you should use, and if it's supposed to be 10 mils, 15 mils, yes. So you can actually see the picture of the calibrated spoons there. Yeah, something like that would be good enough to be used for Okay, so besides spoons, yes, we have syringes. So this is by far the most accurate when it comes to liquid measuring, as it's accurate to very small volumes and also a popular choice for kids, It's also easy to use and clean. And however, the reading has to be done the right way, and you always use the plunger ring closest to the tip to read the volume contained in the syringe. You can actually see the picture in the slide. Yeah, so you see where the 4 mils is. You see the rubber band there with the, you see the black. Yeah, so it's right there to get the exact measurement.
Yeah. When my kids were younger, actually, this was what I used to get the medication. Actually, I just press this a little bit against the inside of their mouth. Just press a little bit so that they don't choke. So that the liquid, what do you call it? The syrup, the cough syrup will just slide through the throat lah.
Yes, that's a good way of
all kinds of mom sticks.
Yeah, so stringing out suspensions are a bit more of a challenge due to suspensions being slightly bigger in particle size as compared to normal syrups. So, that is why the dilution of suspensions have to actually be done the right way with the right diluent. And what we normally do is when you actually have to dilute a suspension, once you've already put in the diluent, the required amount, you shake the bottle like up and down this way. Yeah. Not just this way, some of them just do that. So for best way would be this way and this way. Yeah.
Okay. At that speed?
For suspensions.
Okay.
To make sure that they're diluted the right way so that the stringing out is slightly easier.
Yeah, of course.
Yeah. Okay, so let's move on to the next slide where we have the measuring cups. So choice for most adults who require measuring liquids. However, there's a disadvantage where it's not suitable for doses measuring less than 5 mils. So anything more than 5 mils is fine. Even though it's like calibrated at the bottom, it's not very accurate due to, you actually have to see the meniscus. So if it's less than 5 mils, I would recommend maybe you use a syringe instead.
Okay. How do we make sure that, if a patient takes syrup, medicine from if they take it this way, and usually it doesn't clean through when it is poured, and then there is some remnants the syrup, there'll still be some left behind. So how can we make sure that the patient will finish entirely contents of this cup so that they get the right dosage?
Okay, what we recommend is maybe just add a few drops of water and, just down in the cup and just make sure you finish that.
Yeah, because that's really important. Because I remember I think some years ago when there were none of these apparatus to take medication, and when our moms used to give us medication using a metal spoon, and then what we'll do, of course, the mothers would ask their children to just lick the spoon clean to make sure that they get the right dosage.
Yes, I know. Yeah.
But it's a lot easier now. All right, so
All right, so let's move on to the next slide then. Yeah, so, okay, the right route, it was one of the R's, required for the medication administration. So this is very important as well. And most of the time it's based on the drug dosage form. So those form here would be tablets, capsules, liquid, injections, eye, ear, nose drops, pessaries, suppositories, ointment, cream, sprays, basically all types of dosage forms. So please take note that not every tablet is to be swallowed. Some actually need to be placed under your tongue for immediate effect. Some are actually inserted into the vagina. Okay. Also, please take note that not every drop is to be inserted into the eye or nasal cavity. Some drops are actually taken orally. Okay, so we'll just breeze through this routes because if I'm going to go into detail, we'll be here forever. So I'll just give you some general example of medications which use these routes. Okay, so for the intravenous and intramuscular would be your injections, normally at hospitals. So this route would be your example would be insulin pens, okay, for diabetic patients. And for topical local effect would be your creams, ointments, anything for external use. Inhalation, we've got two types. One is via the nasal cavity and one could be via your mouth. So for the nasal one, you have your nose sprays, you have steam therapy. And if it's through your mouth, you have your MDI, your inhalers, AccuHalers, Turbuhalers, BreezeHalers, okay? And okay, moving up, so there's the oral route. This is the most widely used for medications which are taken internally, which are consumed. And then you have your vaginal route, rectal route. Sublingual will be placing the medication under your tongue for rapid effect. And then we have transdermal for your patches. Okay, so yeah, let's go on to the next slide. All right, so how do you know that you're taking your medications at the right time? Okay, this is basically the right time would be based on how frequent you need to take your medications. So it could be a daily dose, it could be a weekly dose, monthly dose, 3 monthly dose, 6 monthly, yearly, once in every 5 years, once in 10 years or so. You know, that's normally for certain vaccinations. So let's just go to the daily one first. So if it's once a day, it's normally taken every 24 hours. So you can use this as a guide where once a day dosing is normally taken at 8 a.m. in the morning, and the next dose would be at 8 a.m. the next day. Okay, if it's a twice daily dosing, it would be twice a day, so every 12 hourly. So you take the first dose at 8 a.m. and the next dose would be at 8 p.m. on the same day.
Okay.
Yeah, and then there is, if it's a 3 times a day dose, you have to take it every 8 hourly. So this guide says taking it at 6 in the morning, your next dose would be at 2 p.m., your final dose would be at 10 p.m.
Okay.
Then we have the one which is taken 4 times a day. Okay, this is every 6 hourly. It's normally for antibiotics.
Okay.
So yeah, as you can see, the timing is a bit, okay, you have to take it really early at 6, you know, and then the next one at 12, and then the next one again at 6 in the evening. And it states here the next one at 12 midnight. So, okay, another time for Kesabana episode where I come and say like, I am still asleep at 6 a.m. or, you know, I sleep as early as 10 p.m. You don't expect me to wake up at 12 a.m. to take my dose and then just go back.
Yeah.
So it's okay. Yeah, don't worry. You can make some minor adjustments to this timing. What you could do is if you have you need to take it 4 times a day, you could adjust it to a 4 hourly instead of a 6 hourly dose. So for example, you can take your first dose at 8 a.m. and 4 hours later would be 12 p.m. for the second dose. Another 4 hours would be 4 p.m. for the third dose, and the final dose you can take it at 8 p.m. Okay, so basically it's shorter hours, but meeting the frequency. And ideally, this time should be at least 4 hours apart.
All right.
Yes, and then we do have certain medications which you are required to take 5 times in a day. For example, acyclovir is an antiviral, normally for chickenpox, and yes, the dosing is actually for 5 times a day. Yeah, you could actually adjust the hours whereby you could take it maybe the first dose at 6 a.m., the second at 10 a.m., third dose at 2 p.m., the fourth dose at 6 p.m., and the final dose at 10 p.m. So you've got all the 5 doses taken in a day. Okay, so yeah, basically that's about, drug. Okay, next.
Since we are on the subject of dosage just now, we can always bring up a question that we're going to ask later, but it seems it's quite the right time to ask about this. Sometimes people tend to forget whether they have taken their medication or not. So let's say it's a medication that you have to take every day at the same time. And then you don't because you've forgotten.
Okay, all right.
It's like 8 p.m. and then suddenly at 9 p.m. you're thinking whether you have taken it or not. This is if you are not using any sort of tips to remember. That's one example. Maybe another example, you don't know whether the medication, this is the 3rd time ke, the 4th time ke, and then maybe you try to adjust it yourself. You take it earlier or later. There's a danger in trying to reorganize the time that you take your medicine. I suppose maybe you elaborate on that.
Okay, so
why that's not recommended.
Yeah, it's not recommended because, okay, firstly, you wouldn't know whether you've actually taken the drug and then you're taking it again. So that could be an overdose for you.
Okay.
Yeah. So yeah.
Okay. All right. So how can patients make sure that get the right dose when they take the medication. Okay, just now you showed all the characters already. Now let's talk about the differences between drug allergies and drug side effects.
Yep. Okay. All right. So drug allergy, when the solution actually becomes the problem. All right. So can experience allergic reactions to just any type of medication, although some are actually more common than the others. So antibiotics are actually the most common source of drug-related allergies, where at least 1 in 10 person have been reported being allergic to penicillin. Penicillin could be penicillin, could be cephalosporin or sulfur group antibiotics. Okay, so other common allergies are to NSAIDs, which provide relief by reducing inflammation. So, yeah. All right, maybe we could move on to the next slide, whereby we can actually speak about, yes, the differences between allergy and side effects. So how do you know that it's an allergy reaction, and how do you know if it's a side effect? So basically, it's an allergy because there is an overreaction of the immune system to a foreign substance, and this is normally unpredictable. It can happen to any patient at any time. So, for example, you would experience this if you're allergic to a certain drug. You would get this itchy skin or eyes, your skin gets all these rashes, your lips get swollen, your tongue also gets swollen, and basically your whole face gets swollen. But when it comes to side effects, it's unwanted and often unavoidable. However, we are able to predict the side effect from the pharmacological profile of the drug. So basically, it's we can actually sort of like predict in advance what is going to happen if you take this medication. That's why we would actually get the doctor to prescribe you something else to counter that effect. Like, for example, if you're on an antihypertensive medication which causes dry cough, it's a side effect. Okay, so the doctor would prescribe you with a bottle of antitussive cough mixture. So you can actually stand by that in case you have the cough develops, so you can take that to suppress the cough. Okay, then there are certain medications which actually act harsh on your stomach, so your doctor would actually prescribe you an antacid to avoid side effects like gastritis.
Okay.
And then if the medication causes you drowsiness, we can actually already inform the patient in advance that this medication, one of the side effects is drowsiness. So you may want to take it at night before you go to sleep. Don't take it during the daytime because you'll end up, being drowsy. Or if it's a medication which impairs eyesight, we would probably tell them in advance, please do not go driving or, handle any machinery or operate any machinery because it's going to be dangerous. So basically, with the side effects, we can actually tell the patient in advance what's going to happen, and we can counter the effect with probably some medication. Whereas allergy is, something you won't know until you get it.
Okay. Yeah. Sometimes the pharmacist would actually ask the patient, "Are you allergic to any medication?"
Yes. So
if the patients know well and good, but sometimes they don't, and perhaps it's the first time that they're taking that medication. What would you advise in that scenario?
Yeah. Okay. If they're allergic, if they actually develop this kind of
unfortunate trial and error
stuff, then definitely there's probably an allergy reaction, and they should actually
if you already know, then you know what to avoid. But sometimes
yes, because allergies can actually be very serious and life-threatening.
Yes,
so it's
exactly,
the patient actually speaks up, and informs the doctor or pharmacist if you are allergic or you feel that you may be allergic to a certain medication. And if you're confirmed allergic to a medication, you actually should be carrying around your allergy card. Like in the previous slide, there was that yellow card. It's normally given to you by your doctors. Yeah, if you are confirmed allergic to a medication.
That's convenient.
Yeah.
Okay, so side effects and allergy. Anything more to add to the topic before we move on to the next one?
No, I think we can actually move on to the next
Yeah, we're
slide.
done with this. Yeah, allergy and side effects. Oh, in case of viewers, sorry, ladies and gentlemen, if you'd like to ask any questions while we're going through the presentation, perhaps you can just type your questions in the comment section below, and Miss Kaveeta will be more than happy to answer your questions right after this. Okay, we'll answer your questions live on air. The next question now is about drug labels. Sometimes people do take their medication and they just take for granted that they already know what to do. But it is still important, like you mentioned much earlier during the first two slides, right? You did mention that it's very important to look for the 5 R's when you are looking at the drug labels. Sorry, did you mean the drug labels on the packaging?
Yes, drug labels on the packaging. Yes.
Okay. Why is it important, those drug labels?
Okay.
If the pharmacist has already explained to you how to take the drug, what time and what's the dosage, why is it still important to read the drug labels that are on the packaging?
Okay, when it comes to drug labels, they do not only tell you what drug you're taking and how many times a day you should be consuming it. They also carry specific instructions which actually help avoid unwanted drug interactions. So, yeah, so as you can see here, we have many types of drugs interaction. So there's drugs and drugs, when they interact with each other. Then there's food and drug interaction. There is supplement and drug interaction, and then certain medical conditions. They also interact with certain drugs, and the possible effects would be either decrease. It could possibly decrease the action of the drug, increase the action of a drug, or could cause adverse effects. And also, certain drugs are actually contraindicated in some populations, so maybe it should be avoided in kids, pregnant women, women who are breastfeeding, or avoided in the elderly. Okay, so we can move on to the next slide. I'll give you some examples. Yeah,
Okay.
so drug-drug interaction, basically this occurs when there are multiple medications involved. So normally if you get a label that states this is not to be taken with a certain drug or a certain drug group, so basically it's because there is a drug-drug interaction, a known drug-drug interaction. And then if it comes to food-drug interactions, so this is common with alcohol or, foods such as chocolate, dairy products, cheese, and caffeinated beverages. So your label would actually state something like, okay, take 30 minutes before meals or 2 hours after meals. Avoid taking dairy products, avoid taking it with alcohol, avoid taking it with certain fruit or vegetables such as grapefruit. Grapefruit has a known interaction with certain cholesterol medications. And then there's which should be consumed less by patients who are on certain anticoagulants. All right.
Yeah.
Then, very famous is the next one is supplements. Yes. Okay. Do not take together with certain calcium or potassium supplements because this may cause imbalance to your electrolyte levels. Yeah. And then traditional medications, traditional supplements like and ginkgo, these also have interactions with certain drugs. So very important for you to read all this and also inform your doctor or pharmacist if you're actually taking these supplements. Okay, and then there are medical conditions such as asthma. By certain drugs can actually make the asthma worse. And, for diabetic patients, certain drugs can actually increase or decrease the blood sugar levels. So yeah. Drug interactions and contraindications can be very dangerous, and I know it's unrealistic, for patients to memorize, every single interactions that your drugs have. Because I'm also unable to do that for every drug, to be honest. So
yeah, of course, because sometimes there's a lot of information. I mean, when I buy any medication that comes from the hospital, and then they do come with a leaflet with small writing, folds and folds of information to take on.
Yeah. So
actually, it's good to have sort of like a relationship with the pharmacy so that you can really ask whatever that you want.
Yeah, because in the pharmacy setting, it's like how Marvel has the Avengers. In every pharmacy we are equipped with references, so this actually helps us to when we read to actually find out what are the interactions. So I personally call this the pharmacy Avengers. So we have the green one where this is the Hulk, and then there's the red, this could be Iron Man, then there's the black, this could be the Black Widows, and we've got all this, but patients, they don't have all this, so how do we actually get the patients to refer which references would be best for them? Maybe you can move on to the next slide.
Yeah. Would you recommend searching for drug info online? This is something that people actually like to do.
Yes.
Perhaps you can make some recommendations. Where are these reliable information available?
Yes, that's right. Yeah, and these are actually all MOH certified drug engine searches. So you can actually just search all this online. Use this as a guidance. Instead of keep Google and asking Dr. Google.
What's the name of this website? This is MOH?
Yeah, no, basically these are the ones recognized by MOH. So we have the Quest, that's to check whether a drug is authentic. And MIMS, this one also you can use to search for drug information, drug interactions, contraindications. And basically drugs.com as well for drug interactions. These are all quite legit websites. You can actually trust them.
No? Okay, what are the dangers of self-medicating?
Okay.
Yeah.
So, nowadays there's, we live in this Zen century where everything is, self-help, self-discovery, self-journey, self that. Then when it comes to self-medicating, okay, this is so wrong. Okay, it's a big no-no. Why? Because there's always the risk of incorrect self-diagnosis. You may think that you have this that's wrong with you, but actually it's something else. And you wouldn't know what dosage to actually take to self-medicate yourself. And you may be taking the wrong choice of therapy altogether. And it may not be administered in the right way. So you should avoid all this self-medicating.
Does self-medication have anything to do with medication that is available over the counter or medication by prescription? That means it's something that you can just get off the shelves at pharmacies. So those are safe in case you want to self-medicate lah.
Okay, when you buy something over the counter at a pharmacy, normally the pharmacist would ask, just like what are your signs and symptoms, and from there we actually are able to diagnose, the normal cough, cold, flu. Yeah, that one is not really known as self-medicating because you still show the signs and symptoms, and you're actually coming to the pharmacy to get it. So it's not.
So these are more serious stuff, okay.
Yes,
they're not talking about your usual lozenges and fever pills. Okay. Right, so that's the dangers of self-medication. What about sharing of drugs? This one actually, it tends to happen as well. In the same house, there's someone who has cough, and you think all cough medication are the same. So in the family, that's the cough, you tend to want to share that.
Yeah, okay. So I know that, I know that sharing is caring, and I would assume that sharing medications in most cases is done with the best intentions. However, the bottom line is doing so can result in serious and fatal consequences. So sharing medications is never a good idea, and even more so if it's a prescription medication. So, this could actually cause harm to both parties. So please don't share drugs.
Okay. Right. What is this? A Poison Act. Okay, maybe you would like to elaborate on this?
Yeah, so basically, this is how we would know the grouping of poisons. And okay, group A poisons would be those with high toxic levels. So group B poisons are the ones which are used in treatment where the doctor diagnoses and gives you a prescription for the medication. So you would actually need a prescription to purchase a group B poison. And then group C is the one which is you're able to get over the counter, where the treatments and symptoms are easily recognized. Like, it's just a normal cough, cold, flu. You just go to the pharmacy, and get these from there. It can be dispensed without a prescription, but in the presence of a pharmacist. And finally, group D poisons are the ones which are chemicals used for labs. Yeah.
Right. Okay. So those are the information about purchasing drugs over the counter and drugs that come with doctor's prescription. What about, let's talk about antibiotics. Why is it important for someone to complete their course of antibiotics?
Yeah, so we often get patients coming, so more case of episodes whereby they tell us, okay, I've stopped my antibiotics because I'm feeling better. Okay, patients are advised to finish their course of antibiotics even though you're already feeling better, because this will actually stop the infection from returning, and also reduce the risk of bacteria becoming resistant to the antibiotics. So you really have to complete your course to avoid antibiotic resistance from building up. Okay.
Okay. Oh, the next one. Okay, sorry. What's the correct way to store drugs?
Yeah. So proper drug storage is always very important. And so the recommended storage conditions would be, if it says needs to be kept at frozen temperature, would be from -10 to -20. And then if it says refrigerate, you should not keep it in the freezer, keep it in your fridge. This would be 2 to 8 degrees. And then there is if it says store below 25 degrees, so it should be an air conditioning room. And if it says store below 30 degrees Celsius, that would be a room temperature. Okay. It's also very important that, certain drugs maybe have to be protected from light, because this could change the efficacy and the color of the drugs. And very important to do expiry date checks off and on for your drugs which are kept in storage. And for your medication away from kids, okay, high in locked cabinets, and if it's in the fridge, make sure it's in a closed up container, label the container saying there's medicines in it. Okay. All right.
Here's another mom tip. Like, if you want your children medication, if it's something that you suck on, like lozenges, but don't tell them that it's candy, because some moms do that.
Yeah, that's right. Yes, because you never know.
So that the child will consume it, but then you will think, anything that comes in that packaging is candy.
Yes, that's right. Okay, so then drug reminder tools, which basically help out in patients' compliance. So you have your pill organizers, your timer, mobile apps, So you can actually, if you have difficulty in remembering when to take your medications, you can actually consider investing in one of these. Yeah.
Okay. The pill organizer, if you have blisters of pills and then you actually take them out and break them or not, that means you have already taken them out of the packaging and you put them in these pill organizers. Is that okay though? I mean, provided the organizers are airtight?
Yeah.
Or should you just unpack them when it comes the time for you to take them?
Okay. All right. What we would recommend is if you were to use these pill organizers, maybe just organize your pills for a week on a weekly basis. Don't go buying 3-4 boxes and then, just, split, removing all the pills from the packaging and all. And when you do remove it from the packaging, also please make note, you are actually aware what are the medications in it, so that in case there's an emergency, at least you are able to inform your doctor what are the medications, because they've already been removed from the packaging. So it's very important that you know what drugs are in there.
Okay, and you can also use use mobile apps.
Oh, yes, that's right. This is basically like having a diary. So, diary, and it will keep track of everything. So it's quite convenient to use one of these nowadays.
Okay. Okay, so I guess that's the end of the slide. So now we go to the
Last
questions.
slide, yes.
This is the fun part because we get all sorts of questions which are which a lot of people can relate to because these are everyday happenings to do with medication. Like Cecilia Chong, for instance, who's asking why must some medicines be taken with or without food? Okay, what's the difference between taking with meals?
So basically, why some medications be taken? So, like I said earlier, it's due to the absorption. So, certain medications are best absorbed on an empty stomach, and certain probably have to be absorbed, when your stomach is fuller.
Okay. All right. And the next question from Ms. Chanli Hong: do suppository drugs need to be kept in the fridge?
Okay, we normally recommend it to be kept at room temperature, but nowadays, with our temperature being so hot, that's the thing. Yes, we will normally tell, so pastries and suppositories can be kept in the fridge. It shouldn't be a problem.
Okay, all right.
Just make sure that it's labeled because we don't want you to be eating that instead, consuming that.
Okay, here's one by Mr. Fahmi Fat Abdullah. How do we know if the medicine is not safe to consume anymore? Yeah, this is a good question because the expiry dates that are on the packaging sometimes are very impossible to read, especially the ones that are on the blisters because they're not printed in clear ink. They actually are, they're like stamped or embossed at the end of the blister in clear color. For example, if it's silver and then it's just embossed, so it's very difficult to read. And this is a factor for everyone to know the expiry date of medication.
Okay. This one, well, basically, on the strip of the medication, the expiry should be there. But if you do have difficulty in, checking out the expiry, you can always come and ask, the pharmacy staff because we will definitely be able to trace back when the expiry date would be.
Yeah. Okay, so let's just move on to. We don't have any more questions. Okay, so I do have a question regarding the expiry dates just now, because some of us have a medicine cabinet at home, and then some of us would like to be very, very organized and complete lah. That means like they will have a box for if you have fever or if you have a sore throat, so everything's nicely labeled. But then when you have all these things and you don't really have all those symptoms and they tend to collect and they don't have it's a kind of hard to determine, especially with those with very fine writing. How is it that at which point would you advise to get rid of medication if you're not sure? Can you just would it be safer to just dispose of all medication if you're not sure of the expiry dates?
Well, definitely, because I don't know what the expiry would be. Or otherwise, you could always just take it back to your pharmacy, and we could check through your records when exactly you've taken the medication and what would have been the expiry date during that time, during that supply of drugs. But if you don't want to do that, then I would just recommend maybe you discard them the right way.
Yeah, even supplements. I think like some people, they collect bottles of supplements. Yeah, but of course that's not that's not really a pharmacist thing. It's more a manufacturer thing lah, because they have to write the expiry date clearly. It's very hard, annoying, especially when you're at my age, and you want to read small writing. Okay, so that's our banter for today. Thank you so much, Ms. Kaveeta Pergas of Columbia Asia Hospital, Seremban. She's a pharmacist there, and she has kindly shared with us information about how to get the most out of your medication.
Actually, there was one more, just the last slide. Could you just?
Oh, yeah, sure. Okay, all right. Is it on the slide? It's such a wonder drug. Okay, what's this about?
So this is another question I always get from my patients. I've got it a couple of times. Unfortunately, not, are you single, available? Can I take you out for coffee? It's more of like, is there is there any chances of, anybody coming up with this thing called a wonder drug where this pill that can, cure all sorts of ailments,
Yes.
So my answer to them would be, are you not aware this medication actually already exists? And the beauty of this medication is it's easily available. You don't need a prescription for it. There are no stock issues. You won't get an overdose from it, and you can take it without worrying about side effects. And here's the best part: it's completely free. So you want to know what medication this is, you probably want to grab a pen and paper and write this down. So the name of this medication is called laughter. Okay, it's always the best medicine. But also remember that if you find yourself laughing alone, then you may need medication. Okay, all right, thank you. Bye.
Okay, bye, Miss Kaveeta. Thank you.